Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomy of the thoracic splanchnic nerves. The thoracic splanchnic nerves are a group of paired visceral nerves that carry preganglionic sympathetic fibers. These nerves are involved in autonomic control of abdominal organs, particularly the sympathetic segment of the autonomic nervous system, and that sympathetic function is done on the abdominal organs. They originate from lateral gray horn of the thoracic spinal cord, passes the thoracic sympathetic ganglion from T5 to T12 without synapse. They are preganglionic, not sympathetic fiber. They do not synapse. There are three thoracic splanchnic nerves. The greater splanchnic nerves are coming from the sympathetic ganglion T5, T6, T7, T8, T9. Lesser splanchnic nerve arises from, actually passes through T10, T11 sympathetic ganglion. Sympathetic ganglions are a chain of ganglion, the paravertebral ganglion. They are placed at the side of the vertebra, extending from the base of the skull to the coccyx. Around 22 to 24 sympathetic ganglions are present in the sympathetic trunk. Out of them, in the thoracic region, it is about 12 sympathetic ganglion. Sometimes maybe one decrease, maybe 11. But as a whole, thoracic region will get about 12 thoracic sympathetic ganglion. They are not in the sympathetic trunk is paravertebrally located, and it is not inside the vertebral canal. It is by the side of the vertebral column. So we have three splanchnic nerves greater coming from T5, T6 to T7, T8, T9 sympathetic ganglions of the sympathetic trunk, like least splanchnic nerve coming from the 12th sympathetic ganglion from the sympathetic trunk. Okay, so this is the beginning from the lateral gray horn. The first order neuron goes through the white rami communicants to the sympathetic ganglion, but without synapsing. It is going down as greater splanchnic nerve. It is coming from T5 to T9, and like that we have lesser splanchnic nerve is from T10 to T11. Lesser splanchnic nerve, least splanchnic nerve from T12. They enter the thorax, and they enters the abdomen from the thorax. They are in the thorax on the posterior thoracic wall. They enters the abdomen by passing through the crus of the diaphragm or behind the medial arcuate ligament. Okay, so we are seeing the greater splanchnic nerve here, lesser splanchnic nerve, least splanchnic nerve. Okay, so this is the least splanchnic nerve is this. This is lesser splanchnic nerve. Lesser splanchnic nerve is getting contribution from T10, T11, and from T12 we used to get the least splanchnic nerve, and the greater splanchnic nerve from T5 to T9, and the lesser is from T9 to T11. This is the least splanchnic nerve. They are going to the abdomen by passing through the crus of the diaphragm, and they will end up here in the ganglion, the prevertebral ganglion, like that of the celiac ganglion, aorticorenal ganglion, superior mesenteric ganglion. So it will be distributed to the abdominal organ via those postganglionic fibers. So up to this level, preganglionic. From this part, it is postganglionic. Okay, again we have the thoracic splanchnic nerve, greater splanchnic nerve from T5 to T9, 5, 6, 7, 8, 9. Lesser splanchnic nerve from the 10th, 11th. Least splanchnic nerve is from 12th. Okay, so they will be end up, actually they will synapse here in the celiac ganglion, the superior mesenteric ganglion, aortorenal ganglion, but they do not synapse in the sympathetic chain of ganglion. This is the sympathetic chain of ganglion, like superior cervical sympathetic ganglion, middle cervical sympathetic ganglion. This is a stellate ganglion or cervical thoracic ganglion, a combination of the inferior cervical sympathetic ganglion and the first thoracic sympathetic ganglion. This sympathetic trunk end up in front of the coccyx, another side sympathetic trunk. This is the ganglion impar. Okay, and the postganglionic fiber from this celiac ganglion, supramesenteric ganglion, will be distributed to the abdominal viscera. The gastrosplanchnic nerve origin T5 to T9 sympathetic ganglia pathway travels through the crus of the diaphragm to synapse in the celiac ganglion. Innervation provides sympathetic innervation to the stomach, liver, spleen, pancreas, kidneys, and part of the intestine. Lesser splanchnic nerve origin T10, T11 sympathetic ganglia pathway passes through the crus of diaphragm to synapse in the superior mesenteric and aortorenal ganglia. Innervation supplies the small intestine, kidney, and adrenal gland. Okay, this is the greater splanchnic nerve. Then we'll get the lesser splanchnic nerve, 10, 11. Then 12, from the 12th we'll get the least splanchnic nerve. Up to this it is preganglionic splanchnic nerve. It is synapsing here. Then we'll get postganglionic. Okay, we'll get some of the splanchnic nerve like that of the lesser splanchnic nerve will be go to the aortorenal ganglion, then it will go to the suprarenal gland, and in the suprarenal gland, the sympathetic postganglionic fiber will be the main cells of the suprarenal gland that will produce the epinephrine and norepinephrine. Okay, least splanchnic nerve, T12 sympathetic ganglia, it may be absent around 44% population. Pathway also passes through the diaphragm, often terminating in the renal plexus. Innervation primarily affects the kidney and ureter in about 14% population. Least splanch 44% population. Least splanchnic nerve nerve is absent. Okay, we have some note for the thoracic splanchnic nerve. The preganglionic sympathetic fibers of the thoracic splanchnic nerve pass through the sympathetic trunk without synapsing. So it is containing preganglionic fibers, not postganglionic fibers. Preganglionic sympathetic fibers continue through the splanchnic nerve and synapse at the celiac, aortorenal, renal, supramesenteric prevertebral ganglia. They are located in front of the vertebra. Postganglionic nerves from this ganglia are distributed to the viscera of abdomen. Some preganglionic sympathetic fiber pass through the aortorenal ganglia without synapsing, okay, and end in the suprarenal gland as postganglionic neurons. These are the main cells of the suprarenal gland or adrenal gland. They produce epinephrine, norepinephrine. Sympathetic stimulation causes vasoconstriction and inhibition of the peristalsis. Sympathetic stimulation releases epinephrine and norepinephrine to the blood from the suprarenal gland. Suprarenal gland is over the kidney. It is also called adrenal glands. Clinical significance, visceral pain transmission. This nerve carry visceral afferent fiber responsible for transmitting pain signal from the abdominal organ to the central nervous system, often leading to referred pain. Okay, so We have both afferent and efferent fibers in the thoracic splanchnic nerve. Okay. Efferent will decrease the peristalsis, will cause the vasoconstriction. Afferent will carry the pain sensation to the central nervous system and is associated with referred pain. Splanchniectomy, splanchnicectomy, surgical interruption of these nerves, splanchnic nerve, can be performed to treat intractable abdominal pain such as that caused by chronic pancreatitis or cancer. Pathologies, compression of or irritation of the thoracic splanchnic nerve, such as in case of tumor or trauma, can cause abdominal or referred pain syndrome. Okay, and that's all about the thoracic splanchnic nerve. If you have any question, please feel free to ask me, and please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.